Hey y'all, I'm Michelle with Alive and Well Communities. Thank you for joining me for part 2 of our trauma awareness series. We're doing a 4-part series. This is part 2. Today we're going to talk about the impact of trauma. So we already covered the different types of trauma: private event, public event, community trauma, as well as historical and racial trauma. And we talked about our stress response system and how it's automatically activated based on how our brains are hardwired. And now we're going to talk about the impact of trauma. So I'm going to start with a little video today. And I'm going to mute myself here and let you take a watch and a listen.
What does your parents' divorce have to do with your risk for heart disease? If your mother had a drinking problem when you were growing up, are you more likely to suffer from depression as an adult? Here's what you should know about ACEs. ACEs stand for Adverse Childhood Experiences, extremely stressful events that can happen to a child growing up. Some experiences are so stressful that they can alter brain development, as well as the immune system, increasing the risk of lifelong health and social problems in adulthood. The term comes from the Adverse Childhood Experiences Study, landmark research that shed new light on the root cause of everything from stroke and liver disease to substance abuse and mental illness. In the late 1990s, an epidemiologist from the Centers for Disease Control and a preventive medicine doctor at Kaiser Permanente set out to understand the association between childhood experience and lifelong health. They asked over 17,000 people in the Kaiser Health Plan in San Diego about their health history, as well as difficult questions about their experiences growing up. Anda and Felitti tallied up 10 different kinds of adversity in this largely middle-class and college-educated population. They were stunned to see how common ACEs were. 21% of all respondents were sexually abused as children. 19% grew up with someone who suffered mental illness. 28% had been physically abused. And 2 out of 3 respondents had experienced at least one ACE. The researchers next looked at how someone's ACE score, or the number of adversities they experienced, related to a wide array of serious health and social problems. They saw that the more ACEs someone had, the greater their risk for poor outcomes compared with someone with no ACEs. Someone with an ACE score of 4 had twice the risk of heart disease and cancer. Someone with an ACE score of 5 had an 8 times greater chance of being an alcoholic. And those with an ACE score of 6 or more, on average, died 20 years earlier. With every major problem they looked at in the ACE study, the risk went up for each additional adverse experience in childhood. As Dr. Robert Anda says, what's predictable is preventable. It's important to remember that ACEs are not destiny. ACEs are a tool for understanding the health of a population as a whole. For individuals, an ACE score can be a tool for understanding their own risk for health and social problems, and empower them to make changes for themselves and their children. ACEs tend to get passed down from generation to generation and are common across all income levels, races, and cultures. But increasingly, people of all different professions and backgrounds are coming together to discuss how ACEs affect their communities. They're finding new ways to treat and prevent ACEs. Many doctors are starting to screen their patients for ACEs as part of their medical history. More schools are becoming trauma-informed, considering the source of problem behavior when disciplining their students, instead of immediately suspending or expelling them. To learn more about interrupting the cycle of adversity and improving health and well-being for the next generation, please visit kpjrfilms.co.
Okay. So as you heard in the video, the primer for the ACEs conversation, there were 10 experiences that were covered in the ACEs study. And I don't think it mentions in the video that the ACEs study was actually started because of a weight loss program. There was a doctor who was doing a weight loss program with these 17,000 people, or roughly 17,000 people. And as people started to have success in the weight loss program, they started to drop out. And it didn't make any sense. Why, after having success, would you leave a successful program? So they started to survey people about why they left. And in that time, they also started to ask them a few questions related to their past experiences. One of the surveyors misspoke in an interview and asked, what was your weight at the time of your first sexual experience? And when the respondents started to say 35 pounds, 40 pounds, 60 pounds, they realized that they were working with people who had experienced childhood sexual abuse. And so the thought was there've got to be other experiences that we should be considering as well. And then the ACE study was born. As you see on the screen, there were 10 things that were covered in this ACE study: physical abuse, sexual abuse, and verbal abuse, emotional and physical neglect, living in a household where an adult had a substance abuse issue or an alcohol abuse issue, maybe with adults who had mental health problems or domestic violence against women. Maybe there was an adult who had spent time in prison, or parents were separated or divorced. Now, you will notice that there are a number of things missing from these experiences. So I want you to pause the video for a second and take some time to jot down 3-4 things that you feel like are missing from these childhood experiences that might be adverse childhood experiences within your specific community. So I want you to pause, take some time to jot down those few things, and then rejoin me when you are ready. Okay. So when I look at these 10 things, there are the things that I notice immediately that are missing are the death of a loved one, maybe displacement, homelessness, food insecurity, maybe living without electricity, without power, without running water. So there are a lot of things that are missing from these experiences, but these 10 adverse childhood experiences were a great jumping off point for conversations around what those childhood experiences were and how that had an impact on life later. And so what was discovered in this surveying was that traumatic experiences were much more vastly common, or vastly more common than recognized or acknowledged. And because those conversations weren't happening, right? So more people were having traumatic experiences than we realized. But also that there was a powerful relationship between those emotional experiences as children and the physical and mental outcomes that people experienced as adults. Oftentimes, they were able to connect those childhood experiences to health outcomes like diabetes and heart disease, as well as some types of cancer or depression, alcoholism, drug abuse. You see that specifically when you think back to the different types of trauma that we discussed in part 1. Historical traumas are definitely impacted, or definitely create an impact in the lifelong health of people of various groups, right? So, for example, in the Native community, diabetes runs rampant. And that is something that has been passed from generation to generation and can be tied to the historical traumas of the people of the community. So if you look at the pyramid over on the right-hand side, we see that there are some scientific gaps in the study, but generally we realize that those who've experienced adverse childhood experiences often also develop social, emotional, and cognitive impairments, which lead to adoption of health risk behaviors like smoking too much, drinking too much, being sexually promiscuous, living generally a risky lifestyle. And once those health risk behaviors are adopted, that often leads to disease, disability, and social problems, which can lead to early death. So we see that whole life perspective from conception to death, and how those adverse experiences as children have a lifelong impact on us, and oftentimes have a long-term impact that affects all functioning, including our health, our physical health. So here's a chart. This is one of the charts that you kind of saw in that video that demonstrates the impact of trauma. And this is related to alcohol use disorder. So if someone has experienced an ACE, one or more ACEs, the likelihood of them having an alcohol use disorder is greater. Remember, though, keep in mind that this is not multiple experiences of the same type of trauma. This is different ACEs. So if I've had 4 or more ACEs in my life, then I'm more likely to be an alcoholic. The experience or the possibility is exponentially greater the more adverse childhood experiences I have had. And this is consistent across various aspects of life that were studied in the ACEs study. Now, if we look at this one, the ACE score and indicators of impaired work performance, I think that this is probably something that we can all relate to. If we think back to our first conversation about changing the question, and if we think about how we can oftentimes we create stories in our heads about why certain things are going on. I will be the first to admit that in nearly every work situation I have been in, there has been one person who is late to every meeting, or who doesn't show up on Fridays, or whatever the situation is. And I know that even in my own life, when I have been under a particular amount of stress, work has been hard for me. So if I think back to a couple years ago, I was the primary caregiver for my mother, who had Alzheimer's and breast cancer. She recently passed. And so the stress of having to care for her, choosing to care for her in my home, and then going to work every day to be a teacher and work with high school students, as well as the long and arduous commute that I had some days, those things piled on top of each other created some difficult days for me. And so when we look at ACE scores in relation to work performance, we see that people who've experienced more ACEs are likely to be absent from work. They might have serious financial problems or serious problems performing jobs. And so while it is oftentimes easier for us to translate or transfer the knowledge that we have with regard to being trauma informed to our students or to kids, it's not as easy to do that for colleagues, coworkers, and the parents of our students and kids. Just being mindful that everybody is bringing something to the table. And so even in a work performance situation, how do we make sure that we are creating a community of care around one another, so that when the impact of trauma is manifesting itself in a way that might look like burnout or might look like apathy, how do we build relationships, and how do we start to ask questions so that we can help change the trajectory of that in that situation? And then also, how do we recognize that in ourselves? So again, the prevalence of impaired work performance can be directly tied to the experiences that we've had as children. Now, years after the ACE study was done, the Philadelphia ACE study was done, and they added some new ACEs to the conversation. They added witnessing violence, living in an unsafe neighborhood, experiencing racism, living in foster care, and experiencing bullying. Now, when we talked about the prevalence of trauma in our last session, we identified that kids who lived in foster care later on as adults often had PTSD rates that were through the roof, right? So when they added these components to the ACE study, the number of people who responded and said, yes, I have absolutely experienced that, increased dramatically. Many more people said that they had had those experiences. And so what they found was even more people than we thought who had adverse childhood experiences had adverse childhood experiences, and that impacted them over the course of their lifetime. And remember too, when we think about these different adverse childhood experiences and we think back about the definition and how we defined trauma, it's not just the thing that happened, it's also the possibility of that thing happening, right? So when we add things like witnessing violence or experiencing bullying, when we see that happen to others, it makes the possibility of that happening for us even greater. But then also just having that experience one-on-one has increased the number of people who responded, yes, I've experienced an ACE in the course of my lifetime. It's increased that dramatically. So we're going to do a little exercise, and I want you to take some time as we go through this to pause as needed and maybe jot down some notes related to this. And I'll prompt you along the way. So do I have any gardeners? Let me come back on the screen so we can have a really quick conversation. So I have any gardeners in the space? Anybody garden? I am a gardener. I grew up in an environment with a gardener. My dad had a huge garden in the yard when I was a kid. And as I mentioned, I returned home years ago to be the primary caregiver for my parents. And when I did that, I was like, you know what? We're going to bring the garden back, right? And if you garden or if you grow flowers, you grow plants in your house, you know that it's important to care or tend to the soil so that you grow the things you want to grow, so that you have a fruitful outcome, right? So years ago, I restarted the garden, and it was a huge success. Multiple types of tomatoes, multiple types of vegetables. I had 2 kinds of cucumbers and different kinds of peppers. I had corn. I had a little bit of everything, right? Green beans, my favorite thing to grow in the garden. Easiest thing to grow if the critters don't get to it. And I made sure that I cultivated the soil in a way that would produce a great crop, because there's nothing like coming to the table and saying, you know what, I grew that. I didn't just cook it, I grew it too. So a couple years after I started, I had a new deck built on the back of my house. And as they were building the deck, they were digging the holes for the posts, and they said, hey, Michelle, what do you want us to do with this extra dirt? What do you want us to do with it? You know, we could just throw it in the garden if you'd like. And I thought, that sounds like a good idea. Now all my gardeners in this space are like, oh, Michelle, what did you do? Right? Yeah, not a good idea. I messed with the soil, which dramatically impacted what I got back, the return on my investment. The next year, I didn't grow anything. I grew like a handful of cherry tomatoes, a couple of cucumbers, maybe 1 cucumber, a really tiny eggplant, and a pumpkin, which I didn't plant. So I'm guessing that somehow a seed was dropped into the garden from the past Halloween's pumpkins or something like that. Because I changed the makeup of the soil, I also changed the outcome in a negative way. It wasn't really what I wanted, right? And so I want you to look at this screen, this pair of aces that's on the screen. What we see is in the soil are these adverse community environments. There's poverty, discrimination, community disruption. All of these things that we see in the soil are negative, adverse community environments. And because those are the things in the soil, the outcomes, which we see around the tree, are things like emotional and sexual abuse, incarceration, physical and emotional neglect, domestic violence. So because there's negativity, there are negative things in the soil, negative components in the soil, the outcome is not good. Those are not the outcomes that we want for our kids or for our communities, right? So I want you to take some time. I want you to pause for a moment, and I want you to think about what you want the outcomes to be. I don't want you to think about the soil right now. I want you to pause, and I want you to think, if I could remove all of those outcomes from up above the soil, from around the tree, if I could remove maternal depression and substance abuse, domestic violence, mental illness, homelessness, if I could remove all of those things and replace them with the kinds of outcomes I want for my students, I want for the kids in my community, I want for the adults in my community, what would those outcomes be? Now, I know in education, we often say, oh, we want to produce good global citizens who can compete in a world market. And that's great. But what does that mean? Does that mean healthy relationships? Do we want them to understand that there are a plethora of possibilities for them out there? What do we want the outcomes to be? So I want you to pause, and I want you to come back when you're ready. Go think about what you want the outcomes to be for your school community or for your community in general. All right, so now that you've taken some time to think about what you want the outcomes to be, I'm going to erase those negative things from the soil. All right. Now, I know I still have those adverse childhood experiences up there, but when you think about, let me go back just a second. When you think about what's in the soil currently, we might not feel like we have the ability or the power to remove all of those things, to remove poverty, discrimination, community disruption, poor housing, violence. We might not have the ability to do that, but what we can do is we can infuse the soil with other things that will combat the negative or balance the negative so that we'll create better outcomes. Okay. So the next step in this is I want you to think about, what do you put into the soil? What can you put into the soil of your community to create better outcomes for students, better outcomes for the members of your community? Now, educators are always last to say love. I don't know why, because as an educator, I know we love our kids. We love them and we want them to have great outcomes. So love is absolutely something you're putting into the soil. But what else are you putting in the soil? So I want you to pause and I want you to take some time to jot down the things that you are putting into the soil to create better outcomes for your students. And then join me when you are ready. Okay, so you have created new outcomes for the kids, new flowers around the tree or new leaves on the tree, and you've put new things into the soil. What kind of things did you put in there? Maybe you put a listening ear, understanding. Maybe you put resources. Maybe you put a safe space for students. Whatever those things were, we know that while we can't necessarily change the things that already exist, what we can do is put new things into the soil that would change the outcome. We can be that one unwavering, buffering, supportive person that will change the trajectory of trauma for a kid, right? Or change the trajectory of trauma within our school community. Change the environment in a way that makes better things, greater things possible. Now, I will say that would be a good exercise for you to do individually, like on a building level. As a team, come together and say, what are our kids' current outcomes? What do we want the outcomes to be? Okay, as a team, how can we commit to certain things that we're going to put into the soil so that we can change the outcomes for our students and for our school community and for each other? So there are layers of trauma, and I've heard people talk about how trauma is like an onion. As you peel it back, you just find more trauma. The individual trauma is that surface stuff that's easy for us to recognize, or it's the things that people share, with us that we know about. But when we peel that back, underneath we find the community trauma. And again, we don't often recognize how impactful community trauma can be in our lives. But it does have an impact. And how does that amplify, or how does that collaborate in a way with our individual trauma that might create some negative outcomes? Negative outcomes you see like racism or violence or poverty. And then underneath that community trauma is that historical trauma. That's that trauma that's passed from generation to generation to generation. And beneath that still is the systemic oppression of systems that exist that can continue to perpetuate the experiences of historical trauma, community trauma, and individual trauma for people. And keeping in mind that those systems, every single system that we work and live in the United States, is still the same original system. And while we might put Band-Aids on it, how can we change the system to make it more equitable, to make it more trauma informed, to make it more of a community of care around our students, around our families, and around our colleagues and coworkers? All right. That brings us to the end of part 2. So you will see there on the screen our survey link and our survey QR code. Go ahead and scan that and answer those questions for me. That is feedback for me. That is feedback for us here at Alive and Well. I appreciate you joining me for part 2. I will see you for parts 3 and part 4 very shortly.